Welcome back to Aladdin Creations. Today, we're diving into another fascinating abnormal red cell morphology, stomatocytes, also known as the mouth cells. What are stomatocytes? Stomatocytes are red blood cells that show a central slit-like pallor, resembling a mouth or coffee bean. This shape comes from altered ion concentration inside the cell, leading to swelling and membrane deformity. Causes of stomatocytes. Stomatocytes can appear in both hereditary and acquired conditions. Hereditary stomatocytosis, a rare inherited membrane defect. Alcohol abuse, especially chronic alcoholism. Liver disease, especially cirrhosis. Obstructive jaundice. Post-splenectomy patients. They can also be seen as an artifact in poorly prepared blood smears. Clinical impact. Most patients are asymptomatic, but in severe hereditary forms, it can lead to hemolytic anemia, fatigue, and jaundice. The spleen may enlarge in some cases, and splenectomy is often considered for treatment. Diagnosis. Stomatocytes are best seen on peripheral blood smear under a microscope. They're usually scattered and easy to miss unless you're trained to look for that slit-like central zone. Even a tiny slit in a red cell tells a big story. Understanding stomatocytes helps in diagnosing underlying liver disease, alcohol toxicity, and hereditary conditions. Subscribe to Aladdin Creations for more blood cell breakdowns.